Hi, this is Dr. Karthik, working as professor in Sri Balaji Dental College and Hospital. Today we are going to discuss about tooth numbering systems. So tooth numbering system is the most important thing which every dental student should be familiar with. Learning nomenclature is the first step in understanding dental anatomy. Tooth numbering or shortened system of tooth notation is necessary in clinical practice for recording data and communication. It is used by dentists for uniquely identifying and referring to a specific tooth in the arch. So coming to the parts of a tooth, as we all know, tooth is divided into crown portion and root portion. Crown portion contains enamel dentin and the root portion contains cementum or periodontal membrane with pulp in both the crown and the root portion. Crown is that portion of a tooth which is visible inside the mouth, and the root is a section of a tooth which is below the gingiva or gums. Generally, we divide the mouth into 4 quadrants: maxillary right, maxillary left, mandibular left, and mandibular right. Similarly, we divide the arches into anterior segment and the posterior segment. The anterior segment comprises of central incisor, lateral incisor, and canine, and posterior segment comprises of first and second premolar, first, second, and third molars. So, coming to the crown surfaces of anterior teeth, so it is commonly described in terms of these are the terms which we used to describe the crown surfaces. Labial surface is the crown surface which is next to the lips or the facial surface. Lingual surface or the palatal surface is the crown surface which is next to the tongue or palate. Incisor surface is the cutting edge of the teeth. Major surface is the surface closest to the midline, and distal surface is the surface away from the midline or facing toward the back of the mouth. In case of posterior teeth, then the terms are almost the same. It's referred to as the buccal, which is a crown surface next to the face or the cheek or facial surface. Lingual palatal surface, which is a crown surface next to the tongue or palate. Occlusal surface, which is the biting or chewing surface of the teeth. Nasal surface, surface closest to the midline, and distal surface away from the midline. So these are the teeth surfaces: facial surface, lingual surface, and in the midline. So which is when the tooth surface is near to the midline, it's called the nasal surface. When it is away from the midline, it's the distal surface. Incisal edge or the occlusal surface. So there are various tooth notation systems that are followed, but the most commonly used one are the Palmer notation system, universal notation system, and FDA system, which is nothing but Federation Dental International System. Let's discuss in detail about each system. Palmer notation system in 1861, Adolf Zsigmondy of Vienna introduced the symbolic system of permanent dentition. He then modified it for the primary dentition in 1874. This symbolic system is now commonly known as Palmer notation system or Zsigmondy system. So in Palmer notation system, for primary teeth, it is numbered. It is represented as A, B, C, D, E. So where A corresponds to the central incisor, B lateral incisor, C canine, D primary molar, primary first molar, and E primary second molar. For Palmer teeth, it is described as numbers 1, 2, 3, 4, 5, 6, 7, 8. So this is how the tooth are represented in Palmer notation method. Next is the universal notation system. AD officially recommended the universal system in 1968. In this system for the permanent dentition, the maxillary teeth are numbered through 1 to 16, beginning with upper right third molar. The mandibular teeth are numbered through 70 to 32, beginning with the lower left third molar. The universal system notation for primary dentition replaces uppercase alphabets and not represented as numbers. For primary teeth, the teeth are identified by letters from A to T, capital letters A to capital letters T. Labeling takes place in a circular pattern, and it starts at the maxillary right second molar, which is represented as capital A. It moves to the left side of the maxillary arch and assigns each tooth a different letter in alphabetical order. The maxillary left second molar is J. So the last letter is J. And drop down to the mandibular left second molar, which is K, and move to the right side of the mandibular arch and assign each tooth a different letter in alphabetical order. The last tooth, which is the mandibular right second molar, is assigned the letter T. So this is how the tooth are described in universal tooth number system for primary teeth. Whereas for permanent teeth, the teeth are numbered from 1 to 32, and mouth is encircled as each tooth is labeled. It starts at the maxillary right third molar, which is 1, and it moves to the left side of the maxillary arch and assign each tooth a different number in a numerical order. The maxillary left third molar is assigned the number 60. Drop down to the mandibular left third molar, which is 70, and it moves to the right side of the mandibular arch, and each tooth is assigned a different number in numerical order, and the last tooth, which is mandibular right third molar, is numbered as number 32. So this is how the tooths are represented in numbers in universal notation system. The next is the FDA system, which is a 2-digit system that has been adopted by WHO and ANTERIOR. In this system, the first digit indicates a quadrant and the second digit indicates the tooth within the quadrant. 1 to 4 and 5 to 8 as the first digit indicates permanent and primary digit respectively. 1 to 8 and 1 to 5 as the second digit indicates permanent and primary teeth respectively. So these are the quadrant codes and the tooth codes. The first number, so that's the quadrant, it represents the upper right quadrant. 2 upper left, 3 lower left, and 4 lower right. So it's going to be the same for the primary teeth, but it has got a number 5, 6, 7, 8. Coming to the tooth codes, central incisors are 1, lateral incisors are 2, canine 3, first premolar 4, second premolar 5, first molar 6, second molar 7, and third molar as 8. So in every system for primary teeth, 1 corresponds to the right maxillary central incisor, whereas 1 corresponds to right maxillary third molar. Similarly, 2 is a left maxillary central incisor, 2 is a left maxillary third molar. So in the lower, it is represented as 3 to 3 and for right side, it is represented as 4 to 4 So for primary teeth, it is represented as 5 1, 5 2, 5 3, 5 4, 5 5 for maxillary right upper side, and for maxillary left upper side, it is represented as 6 1, 6 2, 6 3, 6 4, 6 5. And mandibular, it is represented as 7 1, 7 2, 7 3, 7 4, 7 5 for left mandibular region, and 8 1, 8 2, 8 3, 8 4, 8 5 for mandibular right side quadrant teeth. Thank you.